Bismillah ar-Rahman ar-Rahim. I welcome you all, ladies and gentlemen, to this session on acute diarrheal diseases. As far as diarrhea is concerned, it is defined as the passage of loose, liquid, or watery stools. These liquid stools are usually passed more than 3 times a day. However, it is the recent change in consistency and the character of stools rather than the number of stools that is more important. The term diarrheal diseases should be considered only as a convenient expression, not as a nosological or epidemiological entity for a group of diseases in which the predominant symptom is diarrhea. As regards clinical types of diarrheal diseases are concerned, we can classify them into acute watery diarrhea, which lasts several hours to days. The main danger is dehydration. Weight loss also occurs if feeding is not continued. The pathogens that usually cause acute diarrhea include Vibrio cholera or Escherichia coli bacteria as well as rotavirus. The second, as you can see, is acute bloody diarrhea, which is also called dysentery. The main dangers are damage of the intestinal mucosa, sepsis, and malnutrition. Other complications, including dehydration, may also occur. It is marked by visible blood in the stools. And the most common cause of bloody diarrhea is Shigella, a bacteria that is also a most common cause of severe cases. The third is persistent diarrhea, which lasts 14 days or longer. The main danger is malnutrition and serious non intestinal infection. Dehydration may also occur. Persons with other illnesses such as AIDS are more likely to develop persistent diarrhea. The fourth clinical type of diarrheal disease is diarrhea with severe malnutrition, which is marasmus and kwashiorkor, and the main dangers are severe systemic infection, dehydration, heart failure, and vitamin and mineral deficiency. Acute diarrhea is rivaled in importance only by respiratory infections as the cause of morbidity on a worldwide scale. When the World Health Organization initiated the Diarrheal Diseases Control Program in 1980, approximately 4.6 million children used to die each year of the dehydration caused by diarrhea. Diarrhea is still a major killer of children under 5, although its toll has dropped by a third over the past decade. It killed more than 1,600 children under 5 years of age every day in around 2012-13. And although it has decreased, it accounts for 9% of all under 5 deaths, a loss of more than zero point 0.6 million child lives way back in 2012-13. And most of these deaths occur among children less than 2 years of age. As far as the burden of disease is concerned, comparing estimates of the current global burden of diarrheal diseases with previously published estimates highlights that the incidence of diarrhea have not changed much, although overall diarrheal mortality has declined. For children aged under 5 years, median of 3 episodes of diarrhea occurred per child year, which is similar to that reported previously. The current estimates in under 5 children suggest that there are about 1.4 billion episodes of diarrhea per year, with 123 million clinic visits annually and 9 million hospitalizations worldwide, with a loss of 62 million disability adjusted life years, which we call DALYs. Diarrhea is the leading cause of death during complex emergencies and natural disasters. Displacement of population into temporary overcrowded shelters is often associated with polluted water sources, inadequate sanitation, poor hygiene practices, contaminated food, and malnutrition, all of which affect the spread and severity of diarrhea. At the same time, the lack of adequate health services and transport reduces the likelihood of prompt and appropriate treatment of diarrhea cases. It leads to heavy economic burden on the health services. As regards diarrhea prevention indicators are concerned, I'll just be giving you a flavor of all the indicators. I won't be going into detail as far as the stats are concerned, but as you can see in the slide, the diarrhea prevention indicators. The first is the percentage of population using improved drinking water sources. B is improved sanitation facilities. The second is percentage of 1 year old immunized against measles. The third is percentage of children who are underweight from birth up till 5 years of age, then stunted from birth up till 5 years of age, then exclusively breastfed from 0 to 5 months age, breastfed with complementary food from 6 to 9 months age, and still breastfeeding 20 to 23 months age. And the fourth prevention indicator is vitamin A supplementation coverage rate. As regards the treatment indicators are concerned, the diarrhea treatment indicators are very important. Percentage of children under 5 with diarrhea, what we see in it is the percentage of children under 5 with diarrhea receiving oral rehydration therapy with continuous feeding, oral rehydration salt packet, recommended homemade fluids, increased fluids, and continued feeding. As regards use of oral rehydration therapy is concerned, the percentage of children under 5 years with diarrhea receiving oral rehydration therapy, ORS packet or homemade fluids or increased fluids with continued feeding are classified into, divided into gender, which includes male and female statistics, and then residence, whether it's urban or rural, then wealth index quantiles, starting from the poorest going to the second, middle, and fourth, and then finally the richest. As regards the epidemiological determinants are concerned, we use the same agent host environment triad, and as you can see in this slide, these are the agent factors infection causing diarrhea. It includes the viruses, bacteria, and others. You can go through this slide in your layer and read all the organisms which cause diarrhea. As far as epidemiological determinants are concerned, going to the agent factors. As far as the agent factors are concerned, first of all, we have viruses. A great many diarrheal diseases are caused by viruses, and the most important is rotaviruses. And the rotavirus, first discovered in 1973, has emerged as the leading cause of severe dehydrating diarrhea in children aged less than 5 years globally, with an estimated more than 25 million outpatient visits and more than 2 million hospitalizations are attributable to rotavirus infections each year. Rotavirus are shed in very high concentration and for many days in the stools and vomit of infected individuals. And the transmission occurs primarily by fecal-oral route, directly from person to person, or indirectly via contaminated fomites. Then the second cause is bacterial causes, and besides the well-known bacterial causes of enteric infections and diarrheal diseases such as Vibrio cholera, Salmonella, Shigella, toxogenic, E. coli, and Campylobacter jejuni are the most frequent cause of diarrhea, and they produce a potent enterotoxin similar to that produced by Vibrio cholera. The less known pathogens which cause diarrhea are Y. enterocoletica and Vibrio parahemolyticus. And as far as the other causes are concerned, It can include amoebiasis, giardiasis, and other intestinal parasitic infections which are associated with diarrhea. And giardiasis is recognized cause of diarrhea. It flourishes in the duodenum and jejunum, and the organism can present in very large numbers in the lumen of the intestine, teeming with them, and the epithelial surfaces almost smothered with them. Uh, Besides the above causes, malnutrition may lead to certain nutritional diseases such as kwashiorkor, sprue, celiac disease, and pellagra, which are also associated with diarrhea. In the developed countries, the causes of diarrhea may slightly be different. Diarrhea in the newborn is unusual and may be due to inborn errors of metabolism, such as congenital enzyme deficiencies, and it may also be associated with severe infections like septicemia or necrotizing enterocolitis. You can see in this slide pathogens frequently identified in children with acute diarrhea in treatment center in developing countries. I've already highlighted these in the previous slides. As far as the reservoir of infection is concerned, for some enteric pathogens, man is the principal reservoir, and thus most transmission originates from human factors. Example, enterotoxigenic E. coli, Shigella, Vibrio cholera, Giardia, Lamblia, and E. histolytica. For other enteric pathogens, animals are important reservoirs, and transmission originates from both human and animal feces. Examples are Campylobacter jejuni, Salmonella, and Y. enterocolitica. For viral agents of diarrhea, the role of animal reservoirs in human disease remains uncertain to date. As regards host and environmental factors in the high-risk groups are concerned, this slide is self-explanatory as high-risk groups are concerned, but I'll shed some light on host and environmental factors. As far as the host factors are concerned, diarrhea is the most common in children, especially those between 6 months and 2 years. Incidence is highest in the age group 6 to 11 months when weaning occurs. It reflects the combined effects of declining levels of maternally acquired antibodies, the lack of active immunity in the infant, the introduction of contaminated food, and direct contact with human or animal feces when the infant starts to crawl. It is also known. It is also common in babies under 6 months of age, fed on cow's milk or infant feeding formulas. Diarrhea is more common in persons with malnutrition. Malnutrition leads to infection, and infection to diarrhea, which is a well-known vicious circle. Poverty, prematurity, reduced gastric acidity, immunodeficiency, lack of personal and domestic hygiene, and incorrect feeding practices are all contributory factors. As regards environmental factors are concerned, distinct seasonal patterns of diarrhea occur in many geographical areas. In temperate climates, bacterial diarrhea occur more frequently during the warm season, whereas viral diarrhea, particularly diarrhea caused by rotavirus, peak during the winter. In tropical areas, rotavirus diarrhea occurs throughout the year, increasing the frequency during the drier, cool months, whereas bacterial diarrhea peaks during the warmer, rainy season. The incidence of persistent diarrhea follows the same seasonal pattern as that of acute watery diarrhea. As regards mode of transmission is concerned, again, this slide is self-explanatory. Most of the pathogenic organisms that cause diarrhea and all the pathogens that are known to be major causes of diarrhea in many countries are transmitted primarily or exclusively by the fecal-oral route. Fecal-oral transmission may be waterborne, foodborne, or direct transmission, which implies an array of other fecal-oral routes such as via fingers or fomites or dirt, which may be ingested by young children. As regards control of diarrheal diseases is concerned, it is not obvious that many different organisms, some known, probably many unknown, cause diarrhea. It is also clear that they do not act in the same way to cause diarrhea. But from epidemiological point of view, they are considered together because of the common symptom diarrhea. It is now firmly established that regardless of the causative agent or the age of the patient, the sheet anchor of treatment is oral rehydration therapy, such as the one advocated by the World Health Organization and UNICEF. Uh, the Diarrheal Diseases Control Program of the World Health Organization has, since its inception in 1980, advocated several intervention measures to be implemented simultaneously with mutually reinforcing and complementary impacts. These measures center around the widespread practice of oral rehydration therapy. And the components of the diarrheal disease control program, um, the intervention measures recommended by the World Health Organization may be classified as you can see in this slide. These are short term, which includes appropriate clinical management, and long term, better MCH care practices, preventive strategies preventing diarrheal epidemics. Starting from the first, appropriate clinical management. The first is oral rehydration therapy. With the introduction of the oral rehydration therapy by the World Health Organization, it is now firmly established that the oral rehydration treatment can be safely and successfully used in treating acute diarrhea due to all etiologies, in all age groups, and in all countries. The aim of oral fluid therapy is to prevent dehydration and reduce mortality. Then, as far as the recommended formulation is concerned, because of the improved effectiveness of reduced osmolarity (ORS) solution, the World Health Organization and UNICEF are recommending that countries manufacture and use the following formulation in place of previously recommended ORS solution. Uh, since January 2004, the new ORS formula is the only one procured by UNICEF in different countries, developing countries. And it includes the reduced osmolarity ORS, in which there is sodium chloride around 2.6 grams per liter, glucose anhydrous 13.5 grams per liter, potassium chloride 1.5 grams per liter, trisodium citrate dehydrate 2.9 grams per liter, and the total weight is around 20.5 grams per liter. Well, I've explained you in detail, and this is what I, sorry, this is what I have enumerated: the composition of the reduced osmolarity ORS. Then, as far as assessment of dehydration is concerned, um guidelines for assessing dehydration and oral rehydration. The guidelines you can see in this chart. When obvious signs of dehydration exist, the water deficit is somewhere between 50 and 100 ml per kg of body weight. If the child's weight is known, the amount of ORS solution required for the rehydration during the first 4 hours may be calculated by setting the deficit at approximately 75 ml per kg. If the child's weight is not known, the approximate deficit may be determined on the basis of age, although this procedure is less accurate. You can go through this slide and see what we see. How do we classify mild and severe dehydration as far as the patient's appearance is concerned? Radial pulse, we consider the blood pressure, skin elasticity, tongue if it's moist or very dry, anterior fontanelle, especially in very small children, infants. Then urine flow, percentage of body weight loss, estimated fluid deficit. Then in this slide, you can see guidelines for oral rehydration therapy for all age groups. The actual amount given will depend on the patient's desire to drink and by surveillance of signs of dehydration, keeping in mind that the fact that greater amounts should be given to heavier patients, those with greater signs of dehydration, and those who still have watery diarrhea during rehydration. The general rule is that patients should be given as much ORS solution as they want, and the signs of dehydration should be checked until they subside. Well, as far as the introduction of the oral rehydration fluid is concerned, has not only reduced the cost of treatment but also made possible treatment of patients in their own homes by primary health workers or relatives of patients. And the ingredients required for the preparation of oral fluid are inexpensive and readily available. And the solution can be prepared with ordinary drinking water and needs no sterilization. The development of oral rehydration therapy is a major breakthrough in the fight against cholera and other diarrheal diseases. If you've gone through it, now I'll move on to the next, which is intravenous rehydration. As far as intravenous rehydration is concerned, intravenous infusion is usually required only for the initial rehydration of severely dehydrated patients who are in shock or unable to drink. Such patients are best transferred to the nearest hospital or treatment center. The solutions recommended by the World Health Organization for intravenous infusion are Ringer's Lactate solution, also called Hartmann solution for injection. It is the best commercially available solution and it supplies adequate concentrates of sodium and potassium, and the lactate yields bicarbonate for correction of the acidosis. And it can be used to correct dehydration due to acute diarrhea of all causes. And Diarrhea treatment solution also is recommended by the WHO as an ideal polyelectrolyte solution for intravenous infusion. It contains in 1 liter sodium chloride 4 grams, sodium acetate 6.5 gram, potassium chloride 1 gram, and glucose 10 gram. And it must meet purity and sterility requirements of fluid for injection. If nothing else is available, normal saline can be given because it is often readily available. Normal saline is the poorest fluid because it will not correct the acidosis and will not replace potassium losses. It should be replaced by the already mentioned solutions I have mentioned in the preceding slide. And as early as possible. And plain glucose and dextrose solution should not be used as they provide only water and glucose. In this slide, you can see the recommended dose of the IV fluid to be given is 100 ml per kg divided as shown in this slide. As regards the maintenance therapy is concerned, after the initial fluid and electrolyte deficit has been corrected, that is the signs of dehydration, as I showed you in an earlier slide, oral fluid should be used for maintenance therapy. And in adults and older children, thirst is an adequate guide for fluid needs, and they can be told to drink as much as they want to satisfy their thirst. The guidelines for maintenance therapy are shown in this table, and the general principle is that the oral fluid intake should equal the rate of continuing stool loss, which should be measured. Diarrhea usually lasts for 1 to 2 days. Then appropriate feeding is important, and medical profession has reeled for centuries under the mistaken assumption that it is important to rest the gut during diarrhea. The current view is that during episodes of diarrhea, normal food intake should be promoted, as soon as the child, whatever its age, is able to eat. And this is especially relevant for the exclusively breastfed infants and newborn infants with diarrhea who show little or no sign of dehydration can be treated by breastfeeding alone. Not only breast milk helps the infant to recover from an attack of diarrhea, but both in terms of the nutrients it supplies and its rehydrating effect. But it helps to prevent further infection because it has protective properties. Then, as regards chemotherapy is concerned, unnecessary prescription of antibiotics and other drugs will do more harm than good in the treatment of diarrhea. Antibiotics should be considered where the causes of diarrhea has been clearly identified as Shigella, typhoid, or cholera. The symptomatic differential diagnosis of Shigella and cholera can be seen in this slide. You can go through it. For diarrhea due to cholera, the drug of choice is doxycycline, tetracycline, then and erythromycin. For diarrhea due to Shigella, the drug of choice is ciprofloxacin, as Shigella is usually resistant to ampicillin. The medicines that should not be used in the treatment of diarrhea include neomycin, purgatives, tincture of opium, cardiotonics, steroids, oxygen, charcoal, kaolin, pectin, bismuth, then Maxaform, which has no value and can be dangerous. Then we can consider zinc supplementation. When a zinc supplement is given during an episode of acute diarrhea, it induces the episode's duration. It reduces the episode's duration and severity. In addition, zinc supplements given for 10 to 14 days lower the incidence of diarrhea in the following 2 to 3 months. The World Health Organization and UNICEF therefore recommend daily 10 milligram of zinc for infants under 6 months of age and 20 milligram for children other than 6 months for 10 to 14 days. Then we should consider better MCH care practices. And in this, two things are very important. One is maternal nutrition. Improving prenatal nutrition will reduce the low birth weight problem. Prenatal and postnatal nutrition will improve the quality of breast milk. As far as child nutrition is concerned, promotion of breastfeeding should be considered. Any measures to promote breastfeeding are likely to reduce the diarrheal diseases in infants. Then appropriate weaning practices should be considered. Proper weaning practices are a major risk factor for diarrhea. The child should be weaned neither too soon nor too late. In any case, not earlier than 6 months of life using nutritious and locally available foods. Then supplementary feeding should be is important as far as child nutrition is concerned. This is necessary to improve the nutritional status of children aged 6 months to 5 years. As soon as the supplementary food is introduced and the child enters the high risk category, then vitamin A supplementation should also be considered as far as child nutrition is concerned, and vitamin A supplementation is a critical preventive measure. And studies have shown mortality reductions ranging from 19% to 54% in children receiving supplements. A little bit about the preventive strategies. You can see in this slide the preventive strategies which I have mentioned. The first being sanitation, and measures to reduce transmission emphasizes the traditional improved water supply, improved excreta disposal, and improved domestic and food hygiene. Of course, sanitary latrines should be built in rural areas. Contaminated foods of all sorts have been identified as a major vehicle for the transmission of fecal pathogens during early infancy. Example, diluted milk, cereal, gowls, etc., and delays in consumption add to the problem. Then health education is of prime importance. Environmental sanitation measures require educational support. An important part of the health worker's job is to help prevent diarrhea by convincing and helping community members to adopt and maintain certain preventive practices such as breastfeeding, improved weaning, clean drinking water, use of plenty of water for hygiene, use of latrine, proper disposal of stools of young children. Then immunization is an important preventive strategy, and immunization against measles is a potential intervention for diarrhea control. When can We can prevent up to 25% of diarrheal deaths in children under 5 years of age. Then rotavirus vaccine is also very important. Two live oral attenuated rotavirus vaccines were licensed way back in 2006, and the monovalent human rotavirus vaccine, known by the trade name Rotarix, and the pentavalent bovine human reassortant vaccine, the Rotatec, are used. Both vaccines have demonstrated very good safety and efficacy profiles in large clinical trials. As far as the Rotarix vaccine is concerned, it's administered orally in two-dose schedule to infants of approximately 2 to 4 months age. The first dose can already be administered at the age of 6 weeks and should be given no later than at the age of 12 weeks. The interval between the two doses should be at least 4 weeks, and the two-dose schedule should be completed by age 16 weeks and no later than by 24 weeks of age. Then fly control is very important. Flies breeding in association with human or animal feces should be controlled. A little bit about the control and prevention of diarrheal epidemics. This requires strengthening of epidemiological surveillance systems. Then the integrated global action plan for prevention and control of pneumonia and diarrheal diseases is important. Of course, that's a topic in a whole topic in itself. So I'm just giving you a flavor of that. At the primary healthcare level, I would like to mention that the concept of primary healthcare involves the delivery of a package of curative and preventive services at the community level. And in this integrated global action plan, an intersectoral approach centered upon primary healthcare involving activities in the field of water supply and excreta disposal, communicable disease control, mother and child health, nutrition, and health education is regarded as essential for the ultimate control of diarrheal diseases. And then we have the integrated program for prevention of childhood illnesses. It's also a complete. I can talk for a complete whole session on integrated program for prevention of childhood illnesses. With this, I end today's session. While concluding, I would like to again highlight the treatment. Always see your doctor if you experience serious symptoms. Babies and young children with diarrhea need prompt medical attention, and treatment for diarrhea depends on the cause, but may include plenty of fluids to prevent dehydration, oral rehydration drinks to replace lost salts and minerals. These drinks are available from pharmacies. It can be made at home. An alternative is 1 part unsweetened pure fruit juice diluted with 4 parts of water. Then intravenous replacement of fluids in severe cases. I mentioned Fringer's lactate is the best choice. Then medications such as antibiotics and anti-nausea drugs. I've already mentioned about the antibiotics. Then anti-diarrheal medications, but only on the advice of your doctor. And if the diarrhea is caused by infection, antidiarrheal drugs may keep the infection inside the body for longer periods. So let the infective material go out of the body through the stools. And treatment for any underlying condition such as inflammatory bowel disease should be considered. At the end, I would like to share this video with you. You can go through it at your convenience.
बिस्मिल्लाहिर्रहमानिर्रहीम। राय फाउंडेशन के ज़ैली इदारे NCSRH की तरफ से हम आपकी खिदमत में पेश करते हैं हैजा, एक जानलेवा मर्ज। बहनों, भाइयों और प्यारे बच्चों, हैजा एक जानलेवा मर्ज की सीडी देखने से पहले इन बातों का ख्याल रखें। یہ وقت عبادت کا تو نہیں، آپ کو اسکول کا کوئی کام تو نہیں، آپ نے کسی کو وقت تو نہیں دے رکھا، آپ کے ذمہ گھر والوں نے کوئی کام تو نہیں لگا رکھا۔ اگر ان باتوں میں سے کوئی ایک بات بھی ہو تو سیڑھی کو سنبھال کر رکھ دیں، پہلے عبادت اور دوسرے کاموں سے فارغ ہو جائیں، پھر سیڑھی دیکھیں۔
ہم آپ سب کو حیضے سے متعلق اس آگاہی پروگرام حیضہ ایک جان لیوا مرض میں خوش آمدید کہتے ہیں۔ یہ ان تمام پیشکشوں میں سے ایک ہے جن کا مقصد عوامی صحت کو بہتر بنانا اور پاکستانی معاشرے میں خوشحالی لانا ہے۔ آج کے اس آگاہی پروگرام کا آغاز ہم اللہ پاک کے بابرکت نام سے کرتے ہیں۔ پیش خدمت ہے تلاوت قرآن پاک۔ آپ سے درخواست ہے کہ خاموشی سے تلاوت سنیں۔
بسم اللہ الرحمن الرحیم۔
شروع اللہ کا نام لے کر جو بڑا مہربان نہایت رحم والا ہے۔
قل اعوذ برب الناس ملک الناس الہ الناس من شر الوسواس الخناس الذي يوسوس في صدور الناس من الجنة والناس۔
کہو کہ میں انسانوں کے پروردگار کی پناہ مانگتا ہوں، یعنی لوگوں کے بادشاہ کی، لوگوں کے معبود کی، اس بڑے وسوسہ ڈالنے والے کی برائی سے جو اللہ کا نام سن کر پیچھے ہٹ جاتا ہے، جو لوگوں کے دلوں میں وسوسے ڈالتا ہے، خواہ وہ جنات میں سے ہو یا انسانوں میں سے۔
وَلَقَ اللَّهُ الْعَظِيمُ۔
میرا دل بدل دے، میرا دل بدل۔
اللہ کسی قوم کے حال کو نہیں بدلتا جب تک وہ خود اپنے اوصاف کو نہیں بدل دیتی۔
اس پروگرام کے آخر میں آپ کو مترجہ سر باتیں معلوم ہونی چاہیے۔ آج کے اس پروگرام کا مقصد آپ کو حیضے جیسی جان لیوا بیماری کے متعلق بتانا ہے۔ اگر آپ ہماری بتائی گئی چیزوں پر عمل کریں گے تو آپ بہت سے انسانی جانوں کو بچانے میں مددگار ثابت ہوں گے۔ اگر ہمیں خوشحال ہونا ہے تو ہمارا صحت مند ہونا ضروری ہے۔ آپ سب سے درخواست ہے کہ آج جو باتیں آپ سیکھیں گے وہ دوسروں کو بھی بتائیں۔ اسی طرح ہم اپنے معاشرے کو ایک صحت مند اور خوشحال معاشرہ بنا سکتے ہیں۔ اس پروگرام کے آخر میں آپ کو معلوم ہونا چاہیے کہ حیضہ کس طرح پھیلتا ہے، حیضے کی روک تھام کیسے ممکن ہے، ORS کیسے بنایا جاتا ہے، اگر کسی کو حیضہ ہو تو کیا کرنا چاہیے، پانی کو کس طرح صاف کرتے ہیں، کھانے کو حیضے سے کیسے بچائیں۔ اب پیش خدمت ہے ایک گاؤں کی کہانی جس میں حیضے کی وبا پھیلی، مگر ایک بچے کی کوشش سے سب گاؤں والوں نے ایسے اقدامات کیے کہ حیضے کا پھیلنا ناممکن ہو گیا۔
یہ کہانی حیضے کی ہے جس نے ہمارا گاؤں بدل کر رکھ دیا۔ حیضے کے چھوٹے چھوٹے جراثیم پورے دریا میں پھیل گئے۔ یہ جتنے چھوٹے تھے اتنے ہی خطرناک تھے۔ بغیر سوچے سمجھے ہر عورت حیضے کے جراثیم پانی میں اپنے گھر لے گئی۔ مکھیاں حیضے کے جراثیم اپنے پاؤں سے اٹھا کر کھانے تک لے گئیں۔ گندے ہاتھوں نے بھی اسے پھیلنے میں بہت مدد کی۔ ہم حیضے کے جراثیم پانی کے ساتھ ہی اپنے اندر لے گئے، اور تو اور ہمارے کھانے اور انگلیوں پر بھی جراثیم تھے۔ یہ سب کچھ اتنا جلدی ہوا کہ میرے والد صبح تک بہت بیمار ہو گئے۔ میرے والد کو ایسے دست اور الٹیاں لگیں جو رکنے کا نام نہیں لے رہی تھی۔ میں اتنا پریشان ہو گیا تھا کہ میں مدد کے لیے گیا اور نرس کو لے کر آیا۔ میں نے کبھی اتنی تیز سائیکل نہیں چلائی تھی۔ میرے والد کو دیکھتے ساتھ ہی نرس کو اندازہ ہو گیا کہ میرے والد کو ہیضہ ہو گیا ہے۔ ہمیں انہیں بچانے کے لیے بہت جلدی کام کرنا پڑا۔ ہم نے ان کے علاج کے لیے ایک خاص شربت بنایا۔ سب سے پہلے ہم نے پانی کو محفوظ بنایا۔ پہلے ہم نے اسے ایک صاف کپڑے سے گن کر پورے 1 منٹ کے لیے ابالا، اور پھر ہم نے اس 1 لیٹر صاف پانی میں आधा छोटा चम्मच नमक और 6 छोटे चमचे चीनी डाली। इसका जायका आंसुओं की तरह का था और ज्यादा नमकीन नहीं था। मुझे डर था कि मेरी आंखों के सामने ही मेरे वालिद मर जाएंगे, मगर फिर उन्होंने थोड़ा बेहतर महसूस किया। नर्स ने बताया कि हैजे के जरासीम निगलने वाला हर इंसान मेरे वालिद की तरह बीमार नहीं होता, मगर वो यकीनन इस बीमारी को फैलने में मददगार साबित होता है। अब मुझे अपने गांव में साफ पानी ले जाना था और पूरे गांव को ये सिखाना था कि वो अपने आप को हैजे से किस तरह महफूज रखें। मैंने एक लड़की को पानी घर ले जाते देखा। मैंने उसे बताया कि इस पानी को महफूज बनाने के लिए इसमें 1% क्लोरीन के कतरे डाले और आधे घंटे के लिए इंतजार करें। फिर मैंने एक आदमी को देखा जो गंदे हाथों से खाना खाने वाला था। मैंने उसे बताया कि खाने से पहले गुस्ल खाने से वापस आकर साबुन और साफ पानी से हाथ धोया करे, क्योंकि साफ हाथों से ही वो बीमारी से महफूज रह सकता है। फिर मैंने देखा कि गांव के कुछ लोग दरिया में जरासीम फैला रहे थे। मैंने उन्हें बताया कि गांव को साफ रखने के लिए और पानी के जरिए बीमारियां फैलने से रोकने के लिए बहुत जरूरी है कि हम गुस्ल खाने का गड़ा दरिया या नदी से 30 मीटर के फासले पर खोदें। मैंने एक माँ को गैर महफूज तरीके से खाना बनाते देखा, जिस पर मैंने उन्हें साफ पानी से पहले हाथ धोने की सलाह दी। फिर हमने साफ हाथों से उसे धोया, काटा और पकाया। मैंने बताया कि खाना गरम गरम खाना चाहिए और मक्खियों से भी महफूज रखना चाहिए। मैंने पूरे गांव को ये पैगाम पहुंचाया। मैं अपने वालिद को एक बार फिर तंदुरुस्त देखकर बहुत खुश हुआ। हमारा गांव तंदुरुस्त हो गया। अब हम अपना पानी पीने के बाद उबालते हैं ताकि ये तसल्ली हो जाए कि वो साफ है। हम हमेशा रफ़ाए हाजत के लिए गुस्ल खाने इस्तेमाल करते हैं और उसके बाद हाथ भी धोते हैं। खाना भी मक्खियों से पाक है और अब खाना बनाने से पहले हम अच्छी तरह अपने हाथ और सब्जियां साफ पानी से धो लेते हैं। हमने अपने गांव को हैजे जैसी जानलेवा बीमारी से बचा लिया है। अब आपकी बारी है कि आप भी अपने गांव को महफूज बनाएं।
आपने देखा किस तरह गांव के लोगों ने अपने तौर तरीकों में तब्दीली लाकर अपने गांव को हैजे से पाक किया और यूं अपनी और अपने गांव की अच्छी सेहत के ज़ामिन बने।
हैजे की अलामात दस्त लगना, उल्टियां आना, पेट में मरोड़ उठना, बुखार होना, पानी की कमी की वजह से निढाल होना। दस्त लगना सबसे अहम अलामत है। हैजा कैसे फैलता है? गंदे हाथों से खाना खाने से, रफ़ाए हाजत के बाद हाथ ना धोने से, ऐसा पानी पीने से जिसमें हैजे के जरासीम हों, ऐसी चीजें खाने से जिन पर मक्खियों ने हैजे के जरासीम दिए हों। हैजे को कैसे रोका जा सकता है? रफ़ाए हाजत खुली जगहों पर मत करें और लैट्रिन का इस्तेमाल करें। लैट्रिन हमेशा दरिया, नदी या पीने के पानी के तालाब से 30 मीटर के फासले पर बनाएं। रफ़ाए हाजत के बाद हाथ हमेशा साबुन के इस्तेमाल के साथ धोएं। खाने की चीजों को ढांप कर रखें ताकि मक्खियाँ इन तक हैजे के जरासीम न पहुंचा सकें। ऐसी दुकानों और रेहड़ियों से चीजें मत खाएं या पिएं जहां खाने पीने की चीजों को ढांप कर नहीं रखा जाता। खाने से पहले हाथ हमेशा साबुन और साफ पानी से धोएं। अगर किसी मजबूरी में लैट्रिन मुयस्सर ना हो तो रफ़ाए हाजत करने के बाद फुजले को मट्टी से ढांप दें ताकि मक्खियाँ जरासीम को ना फैला सकें। मक्खियाँ हमेशा गंदगी पर बैठते हैं, इसलिए मक्खियों को खत्म करने के इक़दाम करें। अपने घर, मोहल्ले और गाँव में कूड़ा हर जगह मत फेंकें और सफाई का ख्याल रखें। साफ बर्तन इस्तेमाल करें। बीमारों का मुकम्मल इलाज करवाएं। अगर किसी शख्स में हैजे की अलामत हों तो उसे ORS पिलाएं। पेट में मरोड़ उठने या बुखार होने की सूरत में डॉक्टर या किसी नर्स से रजू करें। अगर दस्त या उल्टियाँ 2 दिन तक ना रुकें तो अस्पताल ले जाएं और मुकम्मल इलाज करवाएं। ORS का महलूल बनाने का तरीका: पानी को भूनने के बाद उसे उबाल लें। 1 मिनट उबलने के बाद साफ बर्तन में 1 लीटर पानी डालें और उसमें आधा चम्मच नमक और 6 चम्मच चीनी डालें। ORS का महलूल तैयार है। ये थोड़ा थोड़ा करके मरीज को पिलाएं। जब भी दस्त या उल्टियाँ आए, मरीज को ORS दें। पानी को साफ करने का तरीका: पानी को भूनने के बाद उबालें और ठंडा करके इस्तेमाल करें। पानी में 1% क्लोरीन के चंद कतरे डालें और आधा घंटा इंतजार करने के बाद पानी इस्तेमाल करें। पानी हमेशा ढांप कर रखें। आप सबकी तवज्जो का शुक्रिया। बहनों, भाइयों और प्यारे बच्चों, इस CD के बंद होने के बाद आप सब लोग बारी बारी इन चीजों का जिक्र करें जो आपने अभी देखी और दिल में वादा करें कि आप अपने इर्द गिर्द और मुआशरे को बेहतर बनाने में मददगार साबित होंगे। हम इस प्रोग्राम को तरतीब देने में मुदर्जा ज़ैल अशखास और अदानों के शुक्रगुजार हैं। SDF लॉस PPAF हेल्थ सर्विस मैनेजमेंट कंसल्टेंट आलमी से आगाही प्रोजेक्ट। राय फाउंडेशन एक गैर मुनाफा बख्श और गैर सरकारी अदारा है जिसका मकसद हमारे मुआशरे के मुख्तलिफ मसाइल पर तहकीक करना, तज्जिया और तशरीह करना है और ऐसे तख्लीकी हल तलाश करना है जिनको अमली जामा पहनाकर हम पाकिस्तान को 2030 तक एक तरक्की याफ्ता मुल्क बनाएंगे इंशाअल्लाह। अगर आप अपनी ज़कात, सदकात व अतियात राय फाउंडेशन को देना चाहते हैं या आप वॉलंटियर के तौर पर काम करना चाहते हैं तो मुदर्जा झैल ईमेल या टेलीफोन नंबर पर राब्ता करें। ईमेल raifoundation@yahoo.com, फोन नंबर 042।
Well, ladies and gentlemen, I think this video was really very elaborate, and it gave you an idea about the signs and symptoms, how to prevent diarrheal diseases, and how to prepare the oral rehydration solution, and how to clean water. The takeaway message for today is good nutrition and hygiene can prevent diarrhea. Thank you so much. And any one of you who have questions can either contact me directly or can post the comments, and I will be glad to answer them. Thank you so much. Allah Hafiz and take care.